When she lost both her mother and her job, Shanna Coleman's already unstable health took an ugly turn.
For more than a year after my mom died, I struggled with depression, sleeplessness, high anxiety. My friends and family assumed I must be on some kind of drugs or something because there was no other way to explain it.
For Mercedes Acevedo, life seemed to unravel when the uninsured woman discovered a lump in her breast.
I had to get a biopsy, and the hospital says they cannot do the biopsy because it costs so much money. In a black hole, I didn't have no hope.
For more than 30 years, Zufall Health has been helping underserved people find their way out of hopelessness. And although some of the patients are now new, they are newly arrived. They know that we will treat them with respect. They know that we will see them regardless of income, ethnic origin, or social standing. And very often, that means that we can produce happy endings.
I called the doctor at Zufall. She went into the computer, and magical, she got me an insurance for so low cost. And she don't even know me.
In Mercedes' case, the lump was benign, but her ordeal helped her gain access to treatment for vision and dental services. As for Shanna, doctors discovered that it was a thyroid condition that was making her sick.
Today, I've been able to get that under control. I've gained my self-esteem back. I have a great apartment. I have a few jobs. If it wasn't for Zufall, I don't know that I'd be able to have found my way to where I am.
Zufall is the family doctor for the communities that we serve.
It's growing, yes. How have you been? I've been all right.
We operate in 8 locations in 7 counties here in New Jersey, providing a host of services, including medical, dental, and behavioral health care that extend well beyond initial treatment.
We owe a huge debt to Dr. Bob Zufall and his wife Kay, who launched our center as a modest volunteer clinic in 1990 to provide high-quality health care to the people in Dover who could least afford it.
We started out with no money, and the head of healthcare in New Jersey came and said, I like it. I'll give you $100,000 a year. It just boomed.
But the needs were enormous. After financial setback after setback, this visionary couple persevered. In 2004, a designation as a federally qualified health center offered us the resources to turn their little dream into a life-altering reality. Eventually, foundation grants came our way, and one of them, from BD and Direct Relief, was really a game changer.
For that event, our congressman showed up, the mayor showed up, a whole host of VIPs came to our health center. We made the front page of the local paper. The money was great, but the recognition and the validation of our efforts was priceless. It changed the narrative about our health center from being the little clinic that serves the uninsured, maybe not so great, but if you got no choice, that's where you go, to showing that we were leaders in healthcare services, and we were all about quality.
I've personally been to several hundred health centers in the United States, and I can say, and it's not just because you're honoring Direct Relief, it's because you win every damn award that we think of, that Zufall is at the top of the top in terms of all the things that matter.
We're doubling down on these community healthcare centers. We think they provide us the best result for the dollars that we're investing for the taxpayers.
This is Dr. Richard Watson. Dr. Watson is 87 years old. He has insisted on coming in regularly to see his patients. So to you, Dr. Watson, and the Zufall Health Center, New Jersey, thanks you.
Certainly in the pandemic, we have been seen as a resource like no other to take care of the needs of an entire community, not just the patients who came in the door. 45,000 vaccinations that we've given, more than 80% are for communities of color.
Even the homeless who had signed up for programs at the Market Street Mission in Morristown.
Our guys couldn't leave the building anymore. Zufall set it up so that we could do virtual medical appointments via Zoom. And what a blessing, because a lot of these guys have not been taking care of their health issues for years.
Think about our patients that come from different countries. They're here without family, they're here without friends, so we become their friends, we become their family.
He has epilepsy. So we have been able to get him his medications and avoid him getting recurrent seizures. She says the hardest part was when she had a stroke 2 months ago. She really had no one to take care of him, but she was able to get her the help she needed as well.
We have a population that desperately needs this service. And if it wasn't for the service that Zufall provides, those folks would be forced to go to the emergency room.
So Zufall relies on community engagement.
We go almost everywhere.
For children, we go to schools, we go to parks, especially for vaccinations.
For dental, we've sometimes organized free dental events for military veterans.
Going in and out.
We often see, veterans coming in unable to smile, missing a front tooth, leaving very happy with something that fills in the gaps.
It's better than any dentist I ever been to on the outside.
Another primary care technique for reaching out is our fleet of dental, medical, and food vans, some of which have seen double duty lately for helping flood victims.
Health is really affected by these emergencies and pandemics and floods and hurricanes and things like that. I like that that's part of primary care.
Our staff is highly perceptive too, like the time pharmacist Julie Valdez was counseling a diabetic patient experiencing pain on his right side.
I just know right-sided pain, that's where all the organs are, right? Pancreas. So anyway, I got a doctor. He came over, checked the patient, and he said, I suspect it's an emergency. So I begged the patient, please go to the emergency room. 2 days later, I found out he had emergency surgery for gallbladder removal. It was on the verge of exploding. Sometimes you just stick to what the patient is there in front of you for and you let them go. It just felt really nice because you don't always get to impact someone's life that much.
Actually, Julie and some 400 other members of the Zufall family made an enormous impact on some 40,000 patients who participated in 177,000 visits to all our sites.
We think it's important to train providers in the community-based setting. So right now we have a dental residency program in conjunction with NYU, an internal medicine residency program in conjunction with Rutgers, and a nurse practitioner residency program that we're doing with a consortium of other health centers. There's still much more to do. We just started a partnership with Princeton Hospital and Penn Med to expand access to Zufall services in Middlesex County. And we're soon going to be offering primary care at the Richard Hall Mental Health Center in Somerset County. And we'll soon be completing the construction of our West Orange facility.
No longer a little Dover clinic, Bob and Kay Zufall's brainchild has become a respected medical resource that has earned the support of federal, state, and private institutions. Full financial support, however, is never guaranteed. Federal funding, for example, accounts for less than 20% of Zufall's budget. Now, more than ever, Zufall Health needs to rely more heavily on the generosity and goodwill of donors to sustain our vital mission.
If you can picture what your forefathers were like when they newly arrived in this country, or picture the time perhaps in the last recession when somebody you knew lost their health insurance because they lost their job. If you can empathize with that scenario, then we are asking that you contribute so that others can get the care that they need and help keep us going for another 31 years.